Orthopedics, a subdivision of I Want Second Opinion, a channel dedicated to your musculoskeletal well-being. I am Dr. Raj Prakash, an orthopedic surgeon with special interest in spinal surgery with 3 decades of experience. Join us on this journey as we unravel the complexities of orthopedics, making health information accessible to all. Before going into the program, we have an humble request to you. If you like the contents the channel has been offering so far, we humbly request you to consider hitting the subscribe, notification and the like button. The topic of discussion today is frozen shoulder. We intend to do this particular topic on a 2-part mode. The first part will cover the causes, the pathology and the diagnosis of frozen shoulder, and we will come out with part 2, which will encompass the management, lifestyle modification and how to cope with frozen shoulder. Now, let's go into the topic. The topic of frozen shoulder is self-explanatory. This particular journey will take us through the various aspects from understanding the anatomy and physiology to exploring the stages, demographics, risk factors, and the scientific intricacies behind the diagnosis and management. As we dive into this subject, keep your curiosity alive because there is a lot more to frozen shoulder than meets the eye. Let's look into the anatomy of the shoulder. As we embark on this journey, let's start with the basics, the anatomy of the shoulder joint. Picture these 3 crucial bones: the upper arm or the humerus, the shoulder blade or the scapula, and the collar bone or the clavicle. These bones come together to form the ball and socket joint, and what holds them together is equally crucial: the shoulder capsule. The shoulder capsule is a connective tissue that envelops the joint, maintaining the integrity of the shoulder joint. Knowing this anatomy is of fundamental importance to comprehend, to see how the frozen shoulder develops. Now, let's look into the physiology of the frozen shoulder. Let's dive into the physiological process at play in frozen shoulder. The shoulder capsule undergoes changes. It thickens and tightens, creating a cascade of events. Scar tissue forms within the capsule, and the synovial fluid responsible for lubricating the joint decreases. These changes collectively restrict the shoulder movement, giving rise to feeling of a frozen shoulder. Think of it as if the joint is becoming entangled in its own protective sheath. It's a physiological puzzle that we will unravel as we progress through the discussion. So, let's look into the progression through various stages of the frozen shoulder. Our journey through frozen shoulder involves 3 stages: the freezing stage, the frozen stage, and the thawing stage. In the freezing stage, the pain intensifies as the shoulder capsule undergoes thickening and tightening. This stage can last for several months, and the pain may become more noticeable, especially during movements. Moving to the frozen stage, the pain may ease, but stiffness becomes more prominent. This is where everyday activity can become challenging. The shoulder's range of motion is significantly limited. This stage can persist for several months to a year. Finally, the thawing stage. This involves a gradual restoration of the range of motion. The physiological changes that led to the frozen feeling in the shoulder begins to reverse. This stage can take anywhere between 5 months to 2 years, and during this time, the individual may experience a gradual improvement in the shoulder function. So, who are at risks and what are the risk factors? As we progress, let's explore the demographics and the risk factors associated with frozen shoulder. Observationally, there is a higher prevalence in women aged 40 to 60. Now, let's dissect why certain individuals are more prone to develop frozen shoulder. Risk factors play a significant role. One major factor is immobility. This could result from various conditions including recovery from a stroke or a surgery such as mastectomy, which limits the shoulder movement, inflammatory conditions such as rotator cuff tendinitis or bursitis can also increase the risk. Understanding these trends helps us to identify individuals at higher risk of developing frozen shoulder, enabling early intervention and management. Now, let's look into the underlying factors and molecular mechanism causing frozen shoulder. At a cellular level, prolonged immobility impacts process within the shoulder joint. The lack of movement sets off an intricate inflammatory cascade, triggering changes in the composition of the shoulder capsule. The scar tissue begins to form, and the synovial fluid, which is essential for joint lubrication, decreases. These changes collectively contribute to development and progression of frozen shoulder. This deep dive into molecular level provides us with insights into the science behind the condition. Now, let's look into the diagnosis and the techniques and the process beyond the physical examination. As we transition to the diagnostic realm, it's important to understand that diagnosing frozen shoulder goes beyond simple physical examination. While physical examination allows the doctor to assess pain and limited range of motion, additional techniques are employed to get comprehensive understanding. Anesthetic injections are one such technique. By injecting anesthetic into the shoulder, the doctor can numb the area and better assess the range of motion without influence of pain. This is known as injection test. Furthermore, imaging tests such as X-rays, ultrasound, and MRI are often employed to visualize the internal structures of the shoulder joint. These techniques goes beyond what the eye can see during the physical exam, providing a detailed understanding of the condition and ruling out other potential issues. So, what are all the medical conditions that are associated with the frozen shoulder? Let's connect the dots. Conditions such as diabetes, heart disease, thyroid issues, and Parkinson's disease are not merely coincidental. There are profound molecular connections that elevate the risk in individuals with these conditions. For instance, in diabetes, there is an increased likelihood of developing frozen shoulder. The mechanisms behind these connections are multifaceted and continue to be an area of active research. Understanding these links is crucial for a comprehensive approach to managing frozen shoulder in individuals with these underlying medical conditions. So, let's look into the brief management strategies. We will dwell into the treatment and coping mechanisms in the part 2 of our series. As we venture into the management strategies, we apply science for relief. Of course, medication play a crucial role in pain management. Non-steroidal anti-inflammatory drugs may be prescribed to alleviate the pain and reduce inflammation. Additionally, targeted exercises becomes instrumental in managing frozen shoulder. These exercises are tailored to consider the biomechanics of the shoulder joint. Physical therapy specifically designed to improve the range of movement and to strengthen the shoulder muscle is often a key component of management. The goal is not just to alleviate the symptoms, but to address the underlying physiological changes, promoting a gradual return of normal shoulder function. By applying scientific principles in the selection of medications, and designed tailored exercise regimes, we can enhance the effectiveness of these management strategies. So, from the research perspective, what lies ahead? As we peek into the future, ongoing research paves the way for potential frontiers in understanding and treating frozen shoulder. Advancements in understanding the molecular pathways involved and emerging therapeutic intervention offers a glimpse into what lies ahead. Researchers are of course exploring novel approaches from targeted drug therapies to innovative rehabilitation techniques. This dynamic nature of scientific exploration keeps the promise of better treatment on the horizon. It's an exciting term in the time of the frozen shoulder research, with each discovery bringing us one step closer to more effective intervention and improved patient outcome. In conclusion, shoulder is an unraveled area of complex condition. We have journeyed from anatomy of the shoulder to the physiological conditions within, explored the stages, understood the demographics and the risks, and connected the dots with the underlying medical condition. We will dwell into the depth of the treatment modalities and also coping mechanisms in the part 2 of our series. At this juncture, we want to extend our heartfelt gratitude to each and every one of you for being a part of our incredible journey. Your support and engagement mean the world to us. If you haven't subscribed to our channel, please feel free to do so. Your subscription fuels our passion to bring you the latest and more relevant information in the world of medicine. Stay informed, stay curious, and thank you for being a part of IWSO family.